2, 1.
Okay, take a moment, close your eyes. Imagine having a thin piece of metal in your hand. Now imagine trying to shove that through your skin. It's dull, it's not sharp, it's not going in. So you're like, okay, I want a piercing now. I'm not gonna wait for it. So I'm gonna go to Walmart, I'm gonna buy a piercing gun for like $30 and do it at home. Now you're about to pierce your ear, but let's stop right there. Piercing guns are not safe. They're dangerous, they have sterilization issues, and they just don't give you the best results. They give more trauma than good results. Now today I'm going to talk about the procedures of both professional piercings, sterilizations, and the trauma a piercing gun can cause on your tissue in your earlobe. Okay, so first is procedures. They are very different at the very end of the procedure, but in the beginning, both of them have to mark your ear to make sure that they're even and they're not wonky. So after you dot your earlobe, they get their tools. Now professional, they'll get a little metal tool to clip on your ear to make sure they don't miss the spot. With unprofessional, like Claire's, they just get a cartridge and they put it into the piercing gun. Now, the most important thing about professionals, they use hollow needles. This is a gigantic thing in the piercing world. If you don't have a hollow needle, like the unprofessional way, Claire's way, you're just stabbing something through your ear with no actual entry. It's like having a jelly donut. You have a straw, you poke it through, you have a clear hole. Now, pretend you didn't do the straw, shove your finger through it, you have a mess. That's like, no one wants that jelly donut now. And so with the the cartilage, which is that thing, that's what it's called. It's usually dull, the piercing, like the earring end. Sometimes it can be sharp, but most times it's not. So you're causing unnecessary pain to the ear and around the area that can get infected too. Now let's go to the second point, sterilization. This is one of the big parts too. According to health.com and APP, Association of Professional Piercers, sterilization is when you get rid of the viable microorganisms within the surface you're cleaning. In the medical world, they use an autoclave sterilization machine, which sterilizes all the medical tools they use in surgeries or in like an IV or something like that. And so it's very important to sterilize so you don't get hepatitis from someone else who previously had that needle or a knife, scalpel. So with this, that's the back. So with professional piercers, they don't just use hand sanitizer and clean off the needle. They get it out of a fresh new package. The tong thingies they use to hold the ear, they put that in an auto vac and they clean it. It's such a high temperature that any germs get killed off. Now, Claire's, guess what they do? They just wipe it down with hand sanitizer or wipe. Like, no. So this is what can happen. You're in contact with other people's body fluids because you can't sterilize something that's plastic, and that's all the piercing gun is. You can't just put it in an oven and not expect it to melt. That's exactly what an autoclave is. It's just like an oven. It's not an oven. Anyway, so if you do that, you're risking getting hepatitis or staph infections or even just general infections because you don't know who came before you, who sat in that chair before you, who got pierced before you. And when it comes to children, they go to Claire's all the time because it's a cheap fix. They don't have to go to a piercing professional shop where they're scared because everyone's all tatted up. They go to this nice environment, Claire's, and everyone's all smiles and they pierce their ears. That's not safe. This is a little girl. She's my niece, and this is what happened to her. Her ear got so infected, they had to remove the earring with a knife because I'll explain later, but it got embedded in her skin. Now, let's move on to the third point. The trauma they cause. With the trauma, there can be bruising, excessive pain, infections, keloids, and immense swelling. Those are keloids, and they're like big bumps. And rejection is when you like get a surface piercing and you and it starts to rise out of your skin like a muffin in an oven, except you don't want to eat that. Sorry, that's a weird reference. Sorry, I'm in the way. And when it swells so much, it can encapsulate the earring, so they have to dig it out. And that's expensive and that's painful. Yeah, you just got chills, dude. Yeah. So not only does the skin wrap around it, but it will heal around it, like that. Now, to prevent this, professional piercers use different size bars because not everyone is the same, and that applies to your earlobe. Everyone has different thickness and thinness of their ears. Like mine are very thin, his can be thick. It just depends. I'm not calling you out, dude. Anyway, the piercing bar is very important because it's on top of how thick it is, and then account for the swelling is how much room you need on the bar. So if it's not a big bar, it's a very tiny bar, you're going to have to deal with a ton of immense pain and swelling to deal with, and there's no way to relieve it unless you cut it. Now, I understand that's terrifying, right? But sadly, unprofessional places like Claire's or even Walmart's $30 ones, they have an average size, and that doesn't take into account for any swelling or anyone's different earlobes. So you're paying $30 for an infection where you're going to have to go to the hospital, you're going to have to get them to cut your earring out, seal up the incision with stitches, and not even possibly, you'll have to go to the doctors and get antibiotics. So on top of a painful experience, you have to deal with the surgery bill, the antibiotic bill, and the immense trauma on top of everything. That's not fun. To avoid this, just go to a professional where they will take their time. They will make sure you're comfortable. They will make sure you are safe and feel calm, even for a little child. I wish we'd have done this with my niece. They make it a happy atmosphere. And Claire's, it seems happy, but it's hell. It's not a good place to go. I'm sorry to burst your bubble, but it's true. Now, according to liveabout.com, when it swells, the bar does make room for it, like I said. But on children, you don't need a big bar like that. You need a medium-sized bar, which is also very important because age does matter. It depends on how low your earlobe hangs. It depends on so many different factors you can't even think would be important, but they are, sadly. Now, I hope this hasn't scared you, but there is an opposing side. A lot of people think, oh, you just went to a bad shop. You went to the wrong shop. Just because it's cheap doesn't mean it's effective. But I guess they've never heard the saying, you pay for what you get. No, you get what you pay for. Yeah, that's what it is. Sorry. That really is true. Quality is a thing, and you have to worry about the quality of the metal. You have to worry about the sterilization and all of that. You just can't expect them to know what they're doing. Professionals are trained for a reason. It takes a long time to know how to properly pierce the body or even modify the body. And I could honestly go to Claire's, get a job, watch a couple videos, and be certified to pierce your ear. What if I'm sick? I'm still piercing your ear. That's gross. Gross. I'm serious. This makes me want to vomit thinking about it. I won't, because that's gross too. Okay, let's recap. First, we talked about the procedures, and that was safepiercing.org that told us they are very different, but one is definitely more safer than the other. Then we talked about the sterilization, the autovac, and how you should clean things and why Claire's can't. So you're basically getting comfortable with someone else's blood. You're welcome for that information. And then thirdly, we talked about the trauma that you face. And I'm sorry to say it, but even with a professional piercing, you're still going to experience trauma, but it's definitely not going to cause you to go to the hospital, which I feel like is a big plus. Now, I hope you realize that using a needle is more important because of the hollow aspects, and you don't just get lazy and impatient and go to Walmart because it's Walmart. It's ghetto. Thank you.